So this is Taylor. Taylor, how far along are you?
36.5 weeks.
36.5 weeks. I knew that. So Taylor was referred in by her OB because she was having a lot of pain in her hips related to the pregnancy. And so kudos to her OB for sending her in because we were able to get her a ton of relief. So there's been a lot of curiosity lately about how we do pregnancy adjustments, so I wanted to demonstrate that today. We start with proper placement of the table. So the belly piece drops away and the hip piece comes up, and this gives baby all the space that she needs, he or she needs, to be super comfortable throughout the adjustment. And I just start by getting a good scan. My hands tell me a lot of information and her body is giving me feedback. So one of the things that I'm doing is really listening. I'm listening for feedback in her body as to what her body is wanting. All right, the second thing I'm gonna do is I'm gonna check her leg lengths. And we're a little bit short on the right side. And when we bring them up, I wanna see that both of them are equal as we press them up towards her pelvis. So the left one goes further than the right, so right away we can see that there's some imbalance there. All right, so go ahead and back up just a little bit. All right. The hips can get super tight during pregnancy as the body is releasing relaxin to loosen up the joints in preparation for birth. So sometimes we need to work the muscles a little bit to make everything happy and healthy. There's a really cool coordinated effort that has to happen in order for a baby to be born. Some muscles have to relax and others have to contract, and this allows baby to descend and pass through the birth canal in the most unrestricted way possible. So as we get closer to time for birth, we want to make sure that everything is working and playing well together. All right, so just loosening up that muscle, her hips are immediately much more balanced. All right, many of you squeeze right through here and then release. This is a test for the tailbone. Her tailbone is just fine. It's doing exactly what it's supposed to, and that's fantastic. So do make sure you give me a little bit. All right. So next I'm feeling, and there's a problem right here in her low back. We're gonna use the dropping table. It pops up and it drops back down. And while it's kind of noisy, it's actually extremely comfortable for mom and for baby. So we're gonna put a little pressure in there. And because her joints are already loose, we only needed one little thrust into that. One area that needs a lot of attention is where the change of the curves happens. So normal person has a curve in this direction and then it switches and curves in the other direction. So right here, as belly gets bigger, that area gets jammed up. A little pressure there, that's gonna make for a great day for Taylor. Now, Taylor also works in healthcare, which means she has a lot of stress right up here. She's a nurse practitioner. So we got to make sure that her shoulders are happy and healthy so that she can see all her patients with a smile on her face. And that feels lovely. Okay, pop on up here. We're going to make the table flat. She's going to go on her back for just a couple minutes. All right, right here, my dear. Alrighty. So we're gonna go back to the legs and check, make sure everything's nice and even. We're not even, so there's a couple things we need to check. One is the pubis symphysis. I wanna have you squeeze your knees together. That puts a stress on that bone, and we're gonna be doing an adjustment right there. Okay. So the pubis symphysis is where the hips come together in the front. If this is not in balance, the rest of the pelvis will not stabilize. So we are just on the top side of that bone. Little click is all it takes. And boom, that's happy. We're also going to work on the hip flexor. This muscle lives right down in the abdomen, so we're just going to kind of push baby over just a little bit, wiggle our way in there, and this is a pressure point release. I might get kicked, we'll see. Thank you. All right, lastly, we're gonna check her neck. We need the whole body to work well together. Okay, beautiful. Got one right up top here. Doesn't take much, just a little push. Beautiful. And there you have it. A pregnancy adjustment from top to bottom.